I have the supreme pleasure of welcoming to the stage our next panel on building a successful brand in the Michigan market. Our moderator from Botanique, Anqunette Sarfoh. She's a co-founder of Botanique, and speaking with her will be Steve Goldner, CEO of Pure Green and president of the Regulatory Affairs Association.
Thank you for that wonderful introduction, and welcome everyone. Let's get right into it. So as you know, Stephen Goldner is the CEO of Pure Green, which is a processor here in the Michigan medical marijuana structure. So thank you for being here. And let's begin with talking about your company. So Steve and I both opened our cannabis companies about a year ago. At Botanique, we have accepted an offer to sell. So Botanique is now for sale. If you're a customer, thank you. But it'll be in someone else's hands soon. But you feel that Pure Green is just getting started. So why have you decided to stay in? And you also have a certain target in mind. So tell us about your target.
Thank you very much, Anqunette. Thank all of you for coming. Really appreciate this opportunity to talk to you a little bit. We've just closed the books on our first 12 months of operation. 12th month turned cash flow positive. Our goals for 2020 are to continue this. We actually think that our sales in 2020 will be something north of 100 million. And so we're really expecting a market cap of something in excess of $1 billion. If that didn't get your interest away from the beer, yes, these sound like remarkable numbers, and they actually are. This is a tremendous, tremendous industry, and we're really focused on setting benchmarks, reaching those benchmarks, and then moving on.
So your benchmark is $1 billion valuation in how many years, and how do you plan to get there?
So how we're going to get there is we have something that we call our company Pure Green is the mothership. We're privately held. We're going to continue developing new products. I'm a medical scientist inventor and developed a number of drugs and consumer products. So we have products for the medical cannabis as well as the consumer products cannabis space, and they're doing very well, thank you. And so that's what's actually fueling the growth as we've become a vertically integrated company here in Michigan. Beyond that are a series of spin-outs and out-licensing. We filed 4 patents several years ago. The first one was issued just 2 months ago. So at the young age of 71 and a half, I have a patent in processing marijuana. My daughter thinks I'm cool again. And so that's how we actually reach our sales, as well as our valuations, and the goal is to keep going. With more inventions, I'm filing 2 more patents tomorrow.
And let's talk about patents and getting either patents or FDA approval as well. Are you interested in that as well, FDA approval?
Yeah, so FDA is my life. I'm actually an FDA attorney. Having developed a drug called methadone about 45 years ago with an exit to a very large drug company who was nice enough to pay for me to go to law school. And I became their FDA attorney and worked that for all these years and still have a major consulting company in that area. So what we are doing with our revenues as they come in is, first off, repaying our investors because they were good enough to buy into our vision and dream and put their money on the line, and they deserve to reap those rewards, and the excess revenues are going into essentially an R&D program. We have 3 agreements with FDA for fast-track drug approval in getting people off of opioids, curing treating PTSD, as well as treating pain in pet dogs. All of these are fast-track programs. We think that they'll go pretty well, and that will help with a whole number of other rollouts.
Right. So tell us how the FDA approval process will help your bottom line of your company, especially when you look at the fact that cannabis is legal in Michigan. Adults can grow it, and you can grow it in your home. So we live in this free the weed society. So why is FDA approval core to your benchmark of hitting $1 billion?
Yeah, I know it seems counterintuitive in this, literally, free the weed and all of the people who have suffered with that, for me to try and drive in a different direction, highly regulated environment. I understand that. Our goal is that first off, this plant produces a number of ingredients: THC, CBD, CBN, CBG, on and on and on, all of which have remarkable safety and remarkable efficacy. My goal, just like it was when I was 23 years old and developed methadone to help people, is to be able to help a couple 100 million people, followed by more. And so getting FDA approval is frankly the gateway to unleashing awfully nice, enviable profit margins, that's for sure. But it also is the gateway to worldwide marketing abilities and being able to reach it, because FDA approval gives you World Health Organization stamp, and that's what I really want to drive for, is to be able to bring this medicine to people. We think that we can do that.
Let's talk a little bit about Pure Green, because at Botanic, we actually sell it, and we have a lot of customers who will love it and appreciate it. I wanted to let people know that they're tablets, and they are sublingual tablets. Tell me why you decided to put this plant product into this type of form. I can tell you, when it comes to the customers and the patients that come to Botanic, we have a lot of older patients, and you do have some people who are more comfortable with just taking a pill. However, this is a plant, and we have lots of ways of using it and utilizing it. So tell us why you decided that this application was the best for your business.
So I come out of pharmaceutical science. I know that may be a little different to hear in this room, but that's why you're here, is to frankly hear different sides of it and decide for yourself. The industry that I come from developed a drug called Viagra. It's in the form of a tablet. You've probably not ever seen it yourself, but it is. We don't ask men to utilize it by rubbing it on a part of their anatomy and then igniting it. That's not a very good way to dose pharmaceuticals. So I thought that dosing people with cannabis molecules by igniting it and have it go up in smoke was probably not a very effective way of doing it. In addition, I figured out how to turn oil-soluble THC and CBD into water-soluble, and then you can put it in a tablet. It's also much easier to bake with and cook, but then you can put it in a tablet, and our product begins to take effect in about 2 minutes, and it lasts 8 to 10 minutes. It's 8 to 10 minutes to feel the full effects, and lasts 3 to 4 hours, like a standard tablet that you could buy in a drugstore. So I thought I would develop these products this way. Plus, it's easy for everyone to be able to use, and that was the whole idea, was to drive consumer acceptance in a way that people are used to seeing.
Okay, all right. Let's talk about social equity, and I know that there's going to be a panel about this in a little bit, but social equity also affects both of our companies. What is your thought on Michigan's new rollout of the social equity program?
That's great. Social equity is actually a very confusing, almost sometimes a hot-button issue. And so it means so many things to so many people. My personal slant on it is, well, 3 years ago, I was at the United Nations. There's a policy worldwide that's fading away called war on drugs. And as a USA representative on drug policy, my mission there was to change that from persecution, incarceration, and destruction to actually regulation and medication. And as you've seen in the last several years, country after country has opted out of war on drugs, which is a UN policy, and has begun to legalize cannabis literally worldwide, right here in the States, state by state. So that's the beginning of social equity. We've written that in. It's ingrained in Pure Green's sort of corporate structure. So when we hire people, we hire the best that we can find, like everyone tries to do, of course. So for example, between our production manager, our QA director, both are women, Kenya and Heather, are doing fabulous jobs to be able to push forward because they are leading a team now of almost 55 people. We had 2 employees 13 months ago. So this idea that's part of the social equity of providing great jobs for people who share this mission and vision to be able to do what we're aimed for. Then beyond that, our processing facility here in Inkster is really part of Detroit. So we are hiring people locally, providing the great jobs to be able to do it. But then there's a third arm of it. That is, who are we and what do we do? So I have tablets that work to relieve women's difficult, painful menstrual cycles. We have tablets that work for sickle cell anemia. We have tablets for a whole variety of other conditions, including pain in dogs. While I know they're not our species, but they're our family. And so we need to be able to help friends and family. And we are giving back in that sense from our core essence of who we are.
You're also doing clinical trials. You mentioned the ailments that your products can help alleviate. So let's talk about how you know that these certain types of products work for these certain types of conditions. I know you were generous to give me a few samples. If people don't know, I suffer from multiple sclerosis. And so Steve also has, you're looking into tablets and products that could help people like me. But also you're doing more than just anecdotal observations. You're doing clinical trials, and I can imagine those would be quite expensive.
Yeah, they are expensive, except I own a clinical trial company. So that's not exactly repurposing income from my clients, Lilly, Pfizer, and Merck, but sort of. So we ran 7 clinical trials. Right here in Michigan, there are hundreds of thousands of people with medical marijuana, medical cannabis cards. It wasn't that difficult to get people to volunteer to take cannabis, to figure out if they could sleep better, or relieve their anxiety, or relieve their pain. People really lined up at the door for that. Yes, it is costly. Going through the FDA process does cost a great deal, but I've done it for 45 years, so there are ways to reduce the costs, probably first off by not charging myself for my own services. So seriously though, how we do it is like anything else in life. I made a formula for a tablet so that people could sleep and gave it to 10 people and said, hey, how'd that work for you? And 3 out of 10 said, good, and the other 7 said, nothing. So I changed the formula, revised it, and the next time around, 6 out of 10 said, boy, I had a great night's sleep, and I didn't feel any bad after effects. And 4 said, nothing doing. So we tweaked the formula again, and then 9 out of 10 said I had a great night's sleep. I got a product now. And we build a brand around that, and that's the process. It's an iterative process of invention, innovation, moving forward to be able to do that. And soon we will be running these FDA oversighted trials, actually some of them right here in Michigan with some of the fantastic medical scientists at University of Michigan and elsewhere around the state.
Where do you see the cannabis industry going in the next 3 to 5 years here in Michigan? And also, where does Pure Green fit into all that?
I see a lot of M&A activity happening, beginning to happen here in Michigan as there are roll-ups. At the moment, that's not that much because our supply chain has severely pinched, and it's very hard to get product out to patients in order to purchase, and it will be even harder as full recreational cannabis rolls out to be able to do that. But M&A is coming, federal regulation, federal legalization, you all see it. I testified before FDA at their first hearings on CBD about 7 weeks or so ago, and we keep going back there. So FDA is, as well as every other federal regulatory agency, is going to find a way that CBD is just okay with them. Then there will be all the rest of the cannabis ingredients until finally the plant itself. That's what I see happening, and so M&A is going to happen out of that. Like the previous gentleman here who is building brands, so are we, and so are many, many others. The difficulty with brand management, brand building, is of course you have to build quality into the products. Having a brand like Apple or Ford is not done overnight. It's years in the making to be able to differentiate products based on value, and that's what a brand does. So for a business purpose, we actually see our way of building value for our company through sales here in Michigan and other states, as well as going through the FDA process, is actually faster to be able to do that.
Okay. Well, I see our host is standing there, so I'm taking that as an indication that our time is just about up. But may I ask one last question? Maybe have you tell us, what would you like people to take away from Pure Green? Why are you here? What's your ask? And what are you hoping people leave this room, what is their opinion of Pure Green should be?
Wow. I just wanted to show up and meet a whole bunch of people and give a different version, our version of reality, for you to evaluate. I really appreciate all that Anqunette's done, and you should come up and talk with her afterwards. For myself, I learned from the TED people at my first talk that the idea for me was figure out how to help one person, and then figure out how to help in the same way 10 and 100 and 1,000 and 1,000,000, and everyone here can do that. I need you, Anqunette needs you to take this to heart, to be able to see, and that's how we build a great society, a great country, and a terrific state. Thank you very much.